So sitting comfortably, just taking a big deep breath in through the nose, out through the mouth. As you breathe in, noticing how the body expands. As you breathe out, just watching the body soften as you gently close the eyes. And rather than the mind leading the breath, allow the breath to lead the mind. Notice the sensation of the breath. Notice it where you feel it in the body. If you need to, you can just gently place your hand on the stomach. And just following that rising and falling sensation. Nothing else to do. Allowing thoughts to come and go. And when you're ready, just gently opening the eyes again.
Welcome to beautiful Charleston, South Carolina. I am here on the beach for your yoga class today, and it's a perfect, quick morning practice that will stretch your body and give you an amazing burst of energy to kickstart the rest of your day. Come onto your mat, close your eyes, and bring your hands together at your heart.
Good afternoon. I'm Lee Tant, Public Affairs Manager at Cooperative Health. This April is National Autism Awareness Month. This is an occasion which resonates very strongly with my heart. That's because my 5-year-old son Walker is on the autism spectrum. Autism spectrum disorder is a disability which inhibits neurodevelopment, particularly in the areas of communication, social interactions, and cognitive function. There are different levels along the spectrum. For example, children on the spectrum, some of them aren't able to talk. Thankfully, my Walker is able to talk and actually talks quite a lot, mostly about his love of trains, and it actually is a great learner. Autism affects almost everyone differently. Unfortunately, there are autistic children who have more severe cases with sensory episodes, aggressive behaviors, and communication issues. I remember talking with my former boss, Dr. Vicki Young, at the South Carolina Primary Healthcare Association. She called one evening about a work question. I was driving home, and that's when I broke down and told her about Walker, and I ended up having to pull into the parking lot of a Piggly Wiggly and had a little cry. It was hard, but instead of feeling sorry for Walker and ourselves, we did something. My wife has been an amazing advocate and leader for Walker from day one in terms of getting him the services he needs. Walker started displaying signs of autism around age 2. We learned quickly that early intervention is a key.
Austin.
Yeah, that's the capital of Texas.
Cowboy boots and a cowboy hat.
That's right.
Walker has made tremendous strides through early intervention services provided by the Unum Center for Neurodevelopment located in downtown Columbia. The folks at Unum have been exceptional in helping Walker development. Walker is now talking in sentences and has improved his recognition astronomically. He can tell you where every railroad crossing in the Midlands is located, it seems. He plays with others much better than he used to, and I can't say enough about the dedicated staff at the Unum Center. Walker's my dude. I love him exactly for who he is as a person. People should accept autistic individuals for who they are. I wouldn't change a thing about Walker. I mean, he's so smart and has a thirst to educate himself. Academically, he's actually smarter than some of the kids his own age. He can count to 100, he knows all his ABCs, and even has some reading skills. And he's also very funny. He likes to mess with me sometimes. Yeah, I mean, I'm bragging on him a little, but it's true. I've grown to look at his autism not as a disability, but rather an ability to see the world differently than others. I'm so proud of him, and he inspires me every day. I should note that we are very fortunate that Walker is able to have one-on-one therapy with a behavior specialist 5 days a week. There is a severe lack of autism behavioral therapists in South Carolina and across the nation, and the number of autism diagnoses is on the rise. Autism doesn't discriminate based on socioeconomic status. It affects everybody regardless of whether you're rich or poor. Naturally, autistic children whose parents are more well off tend to have better access to services. For example, one autistic school in the Midlands costs nearly $20,000 per year to attend, which is on par with local private schools like Heathwood Hall and Hammond. As you can imagine, there's a competition for these limited autism therapy spots. Options exist for those less fortunate, but they're even more limited. Another unfortunate fact is that South Carolina Medicaid currently does not reimburse community health centers for autism services. This means fairly qualified health centers like ours can't afford to offer these services. I don't have the answer for solving the autism therapy gap. However, I feel strongly that the more people are aware of it, then the easier it will be to develop solutions. We're one of the fortunate stories. That's not the case for everyone impacted by autism spectrum disorder. Please educate yourself. Chances are you know someone who's on the spectrum. 20 years from now, I would love to see more success stories like my son's. As you can see, these children are precious, and all children on the spectrum deserve a chance to succeed.
Hello, I'm Everett Collier, Director of Nursing at Cooperative Health. On April 7th, we will celebrate World Health Day. This recognition aims to heighten awareness around health concerns, and this year's focus is on health disparities. We knew before the pandemic that health disparities existed, and they are particularly acute in South Carolina. According to South Carolina DHEC, African Americans in our state experience higher rates of health problems in many areas. The COVID-19 pandemic highlights these disparities even further. The CDC reports that Hispanic and African Americans are 5 times more likely to be hospitalized from COVID-19 than white individuals. Socioeconomic factors such as access to care and pre-existing conditions like high blood pressure contribute to these radical differences. Unfortunately, there is a great hesitancy across all demographics to take the vaccine. The Kaiser Family Foundation reports that 37% of all citizens are either waiting to take the vaccine or refusing it altogether. Approximately 48% of African Americans fall into this group. There are a lot of myths about the vaccine out there. Now, let's take a moment to dispel some of those myths. No, authorized vaccines do not contain the COVID-19 virus itself. However, some individuals have experienced some symptoms of the virus, such as fever after receiving the vaccine. Don't worry, this actually means your body is developing protection against COVID-19. No, the vaccine won't make you grow a third eye or turn your hair green. The vaccines do not alter your DNA in any way. You should still get the vaccine. We don't know how long the antibodies produced from the COVID-19 infection last. This means you could possibly get the virus again without a vaccination. If you received antibody or plasma therapy to treat COVID-19, the CDC recommends that you wait 90 days. Yes, it teaches your immune system to recognize and then fight the virus. The Moderna vaccine used by Cooperative Health offers 94% protection against COVID-19. Yes, it is. There is currently no evidence that the vaccine causes pregnancy complications or fertility issues. COVID-19 vaccinations are completely safe and the key to returning to normal life. Vaccines are also a crucial component to addressing health disparities. We encourage everyone to take the vaccine when it's your turn. Let's celebrate World Health Day by making a commitment to getting the COVID-19 vaccine. Thanks for listening.
My name is Leona Holmes. I work with Cooperative Health at Brooklyn Community Pediatrics. I've been working with the organization for a total of 12 years. I have a total of 4 kids, 3 girls and 1 boy. I graduated from ECPI University in 2008 with an associate's degree in health science. I love to travel, I love to shop, I love to dance, and I love crossword puzzles. I grew up in the Eau Claire community, and I grew up with a lot of patients that attend our facilities, so they have a personal relationship with me, so they feel comfortable with coming to our facilities. When I graduated from ECPI University, I was entered into a job placement program, which advised me to work with Eau Claire Cooperative Health Center, where I met a lot of individuals that have the same common goal that I have, to treat everyone fairly and equally. I support the mission by treating every individual with the same equal, fair, professional manner, make sure they have the best quality care ever, and make them want to come back within the organization. Being a patient service representative, we are the initial contact of the visitors and patients who enter our facilities. We are to greet the patients in a professional manner, answer telephone, verify insurance, make sure we collect demographical information, make sure it's entered in the computer correctly, and make sure we offer the Good Samaritan program. We celebrate all of our administrative professionals by saying thank you. PSRs, such as myself, are frontline workers and play an important role at the Cooperative Health. So make sure you tell an administrative professional thank you and have a great day.